If you want to protect your baby's health before they're even born and get a head start with feeling confident about breastfeeding, this video is for you. This is your ultimate guide to collecting colostrum. You'll learn what colostrum is and why it's so important for your baby's health, why you might consider harvesting it, how to get it out of your breasts, what supplies you need, and how to properly store it. But first, who am I? Hi, I'm Liz, a registered nurse who's also a lactation counselor. On this channel, I talk about all things pregnancy, postpartum, birth, and baby care. My goal is to provide you with as much reliable information as I can to empower you to make your own informed decisions. So hit that subscribe button for more videos and join my weekly newsletter where I send you tips and tricks on these topics straight to your inbox. It will also be linked down below. Quick disclaimer, this video is for educational purposes only and not a replacement for medical advice. Let's get started. Why is colostrum so important for your baby? It's often called liquid gold, and not just because of its rich golden color, but because it's packed with nutrients, calories, antibodies, everything your baby needs right after birth. Colostrum gives your baby immunity from the germs in their environment. It coats their intestines from harmful bacteria. It kills microorganisms and reduces inflammation. It also acts as a laxative, helping clear out meconium. Meconium is that poop that builds up in your baby during pregnancy, and you kind of want that out of their system as fast as possible. So colostrum is amazing at doing that. It helps reduce the risk of jaundice, it helps prevent low blood sugar, and it's also perfectly tailored to your baby and what your baby needs depending on what they're born. I find this absolutely fascinating. Basically, every mom's colostrum is different, and it's specifically formulated in the breast for what their specific baby may need. So if your baby is born premature, the colostrum is altered to give the baby those nutrients that a premature baby will need. It really is amazing how that works. Colostrum can make a huge difference in overall health as well and outcomes long term in your baby's life. What is antenatal colostrum collecting? So this means that you collect your early milk, that colostrum, during pregnancy in the final weeks. Usually you do this by hand expressing and storing it in small syringes. The question often arises, well, if I express my colostrum before baby arrives, will there still be any left for them to get after the baby arrives? And the answer is absolutely yes. In fact, it could even help your body start producing more colostrum, and it helps you kickstart that breastfeeding journey to make it easier. Who might benefit from colostrum harvesting? If you're nervous about breastfeeding or unsure about milk production, this gives you a head start because as you eliminate that colostrum from the breast, your body signals to make more. If you have gestational diabetes, your baby is of a low birth weight, or in the NICU, this could be very helpful because if you're separated from your baby, they may just give the baby formula, but if you have that colostrum, he or she will get all those benefits. If you're expecting twins or triplets, if you've had breast surgery or have low milk supply concerns, if you're on medications that may delay milk production, if you're planning on having a C-section or you end up with an emergency C-section, sometimes you can't breastfeed right away, but you'll have that stored colostrum. Also, if your baby has a concern such as cleft palate, which will make latching really hard to the breast, and also simply if you just want peace of mind, just having something ready for the baby. Even if none of these apply, having colostrum ready could be super helpful because the baby might not latch right away after birth because it's sleepy. Like you never know, right? So it's just nice to have something there that they can benefit from. When can you start harvesting? Usually around 37 weeks onward, but it's just good to double check with your provider. what do you need to get started? First thing that you'll need are some sterile syringes. I would start with 1 millimeter in size. You'll need a medicine cup or just a regular spoon if you're going to be collecting from the nipple, which I recommend to collect from the nipple on a spoon and medicine cup and then use the syringe to suction from that. And obviously you'll need your breasts. Newborn stomachs are very tiny. They're about the size of a cherry pit, so they don't need much. So storing the colostrum in those syringes will avoid waste. Now let's get into how to hand express. This is my breast model that I'll be using. So before I show you how to do this, it's important to note that hand expression is a skill. And like with most skills, it tends to get easier with time. So don't get discouraged if you can't get anything right away. It's a skill that's amazing to have on hand, literally, while breastfeeding, because you can use it to relieve engorgement later on in your breastfeeding journey or to stimulate more milk production. It's also a lot gentler than pumping. And also a side note, do not use a pump to get your colostrum out, because the colostrum is a little bit too thick to get out with a pump and you'll just get all frustrated and irritated. So use hand expression to get the colostrum out first, then you can use a pump for the regular milk when that starts coming in within the next couple days. So here is how to do it. Here's your breast. So you want to start off with washing your hands and gathering your supplies. Then you'll want to relax. So you want to find a private, warm, comfy spot. Take some deep breaths, dim the lights, relaxing music, whatever helps you chill out. Hand expression is a lot easier when you're relaxed and not stressed out. And this is because when you're stressed, you have fight or flight hormones flowing and they tend to suppress the milk production. Next, you want to warm up your breast. So you can put a warm compress on your breast, take a shower, or wrap them in a warm towel around your chest. Then you'll start with the breast massage. So you want to use the hands or the knuckles, and you want to kind of press along the breast in a circular motion. Don't forget the undersides as well, and you'll just want to do that for a couple minutes. If you want, you can lean over and let gravity be on your side, so lean slightly and do that to help get the milk flowing. You could also use your knuckles as well. Then you want to use a C shape of your hand, so you want to put the thumb up and then the rest of the fingers around just outside the areola. Make sure you're not actually pressing on the areola. You want to have 2 finger spaces afterwards, and then you want to start pressing here. This is the glandular tissue, the lobules. It's where the milk is produced, and then the milk gets carried by milk ducts to your nipple. I'm going to put a breast anatomy picture up here, and you could see that the milk doesn't get produced at the nipple here, it gets produced in here. So this is what you want to massage, right? You don't want to massage the nipple really because there's nothing there. You want to massage those lobules, that glandular tissue. So once you've gotten in position, the expression technique is you want to press and then compress into your chest and release, and then press again, compress into your chest and release, and then you want to move all around, and then you want to do that on the other side. Press, compress, release. This should not hurt. If it does hurt, adjust your pressure or your positioning. Do this 3 minutes per side and then switch to the other breast, and aim to start for once daily and then increase to about 2 to 3 times as you approach your due date. At first you might get nothing or just 1 drop, and that's totally normal. What do you do with that? You're going to scoop it up into your spoon, then you're going to suction it up with the syringe, just like that. And you're going to put the syringe cap back on and store it just like that. Pro tips: using breathing exercises or relaxation cues can ease tension and make this easier. Be sure to massage before expressing to help stimulate that flow. Frequent short sessions are more effective than longer ones, and it's okay to stop and try again if it's not working. Many people find that harvesting colostrum boosts their confidence and prepares them mentally and physically for breastfeeding. Storage storage tips. How and where do you store them? Pop a cap onto your syringe, store it in a Ziploc bag or the original wrapper if you want. Be sure to label it with the date and freeze it for up to 6 months. If you're taking your colostrum to the hospital, make sure to put it in a cooler with an ice pack. And once thawed, the colostrum is good in the fridge for 24 hours and at room temperature for 2 hours maximum. I have an ebook on boosting milk supply, which you can grab down below as well. I'm also working on a breastfeeding class, and as soon as it's released, I'll have it linked down below as well. Depending on when you're watching this, it may already be out, so watch out for that. If you found this video helpful, give this video a thumbs up and subscribe for more tips. Grab my free newsletter, and I'll see you in the next video.